115 million Americans are living with diabetes or pre-diabetes right now. Tens of millions more were told their blood pressure or cholesterol is dangerously high. But here's the question almost nobody is asking. What if a significant portion of that epidemic wasn't caused by anything happening inside your body, but by something that happened inside a meeting room? Today we're pulling back the curtain on the single biggest driver of the chronic disease explosion in America, and once you see it, you cannot unsee it. We're talking about three diseases: diabetes, high cholesterol, and hypertension. We're going to show you exactly when the numbers spiked, exactly what changed, and exactly what the research says you can actually do about it naturally. Put on your detective hat, because the two most important questions in health are when did it start and what happened just before it started. The answer to both is going to surprise you. The detective question: there's been endless debate about what causes chronic disease. Some say seed oils, some say sugar, some say saturated fat or red meat. But here's what the graphs actually show. When you plot the rates of diabetes, high cholesterol, and hypertension across the last 30 years, you see something striking. The lines trend slowly upward, and then at very specific moments in time, they shoot nearly straight up, overnight spikes, vertical cliffs in the data. The question is, what happened at those exact moments? The answer isn't a new virus, it isn't a new food, it's a new definition. Hypertension, the redefined epidemic. Let's start with blood pressure. For years, the standard threshold for high blood pressure was 140/90. Then in November 2017, a panel of American cardiologists voted to drop it to 130/80. Same people, same readings, brand new category. Overnight, in a single decision, 31 million Americans became hypertensive. Their blood pressure had not changed. The definition of what counted as dangerous had. Here's what makes this even more striking. The UK, Europe, Canada, Japan, and Australia looked at the exact same scientific evidence and said no. They kept the threshold at 140. The same data reviewed by different committees produced two completely different epidemics depending on which side of the Atlantic you lived on. Cholesterol, the moving goalpost. Now let's look at cholesterol. In 1988, a normal LDL cholesterol reading was considered anything under 190. Then in 2001, a committee dropped that number to 130. Statin prescriptions doubled in the following 3 years. Then in 2013, the threshold dropped again. Overnight, 12.9 million people were newly diagnosed with high cholesterol. Today, 86 million Americans carry that diagnosis, and the vast majority are on medication. The cholesterol in their blood didn't change. The number on the chart they had to beat did. Diabetes, the manufactured category. And then there's diabetes, where something even more significant happened. Researchers and policymakers created an entirely new category of illness called prediabetes. In a single stroke, 72 million people became pre-diabetic. Add that to existing diabetes diagnoses, and roughly 115 million American adults now sit in the diabetes or pre-diabetes bucket. The research community hasn't been silent about this. A landmark book called Overdiagnosed, written by Dr. H. Gilbert Welch, MD, documented these patterns in detail and sparked serious discussion within the medical community. The British Medical Journal ran a standing peer-reviewed campaign for years called Too Much Medicine, specifically examining how shifting diagnostic thresholds were creating patients out of healthy people. A significant concern raised in that research: a notable percentage of the committee members who voted to change these thresholds had documented financial ties to the industries that produce the drugs now prescribed to millions of newly diagnosed patients. This isn't fringe thinking. It's published, peer-reviewed concern from within the medical establishment itself. Does earlier diagnosis actually help? The reasonable question at this point is, even if the threshold shifted, does catching people earlier improve their health or extend their lives? The evidence is sobering. For many of these redefined conditions, earlier diagnosis and immediate medication did not meaningfully extend mortality. What it did create in many cases was a cascade, one medication producing side effects leading to a second medication producing more side effects in what researchers have called polypharmacy, a cycle of prescriptions building on prescriptions. This doesn't mean medication is never appropriate. For many people, it is genuinely necessary and life-saving. But the question worth asking, the question that informed consent actually requires a doctor to answer, is whether alternatives were discussed before the prescription was written. The real root cause. Here's the elephant in the room that the diagnostic debate often obscures: what is actually causing the underlying biology to deteriorate? When we look across all three conditions, diabetes, high cholesterol, and hypertension, one driver keeps appearing at the center: chronic elevation of insulin. Chronically elevated insulin stiffens arteries, it raises cholesterol, it causes insulin resistance, it drives prediabetes, and eventually type 2 diabetes. And what causes chronically elevated insulin? A diet high in refined carbohydrates, particularly refined sugars and refined starches. The environment your body runs in matters. Think of it like a fish tank. Pollute the water and the fish gets sick. You can treat every symptom, you can prescribe every medication, but if the water stays toxic, nothing fully recovers. Natural alternatives, what the research actually shows. So the real question becomes, are there natural, evidence-based alternatives for these conditions? The answer, supported by published research, is yes. For type 2 diabetes, a landmark study showed full reversal of type 2 diabetes after 12 months in 46 out of 100 participants through dietary intervention alone, not partial improvement, full reversal. This information deserves to be part of every conversation a doctor has with a patient before a prescription is written. For high LDL cholesterol, research supports several natural approaches. Red yeast rice has been shown to lower LDL. Niacin significantly lowers LDL and raises HDL. Plant starls can reduce LDL levels. Regular exercise lowers LDL. And a low carbohydrate diet has demonstrated meaningful LDL reduction across multiple studies. For high blood pressure, the evidence is similarly strong. Garlic has been shown in clinical trials to reduce systolic blood pressure by 8 to 10 points. Hibiscus tea produced results in one study comparable to a prescription ACE inhibitor. The DASH diet combined with sodium reduction significantly lowers blood pressure. Exercise reduces it. Increasing potassium while lowering sodium reduces it. And magnesium supplementation has demonstrated consistent benefit. Now, none of these have been tested together in a single randomized controlled trial. The research methodology used in medicine is designed to test one thing at a time, but common sense, supported by the individual evidence on each intervention, raises a powerful question. What happens when you stack several of these lifestyle changes together? Change the diet, add exercise, improve sleep, reduce stress, address the root cause instead of managing the number. Here's what we want you to walk away with today. Much of the chronic disease epidemic in America is real, but a significant portion of the spike in diagnoses was triggered not by deteriorating health, but by shifting definitions. The same person with the same body went to bed healthy and woke up with a diagnosis because a committee changed a number. That doesn't mean the underlying conditions aren't serious. They are. Uncontrolled blood pressure, genuine insulin resistance, and truly elevated cardiovascular risk all deserve attention. But the theme running through all three, insulin resistance at its core, driven by diet and lifestyle, points towards something hopeful, because what lifestyle created, lifestyle can often address. You are not simply a number on a chart, and a diagnosis that was partly manufactured by a definition change is not a life sentence. If this video helped you see something differently, share it with someone who's been handed a diagnosis and never been told there might be another path. They deserve to know this conversation exists. And subscribe to Nature Cures, because understanding the system you're in is the first step to taking your health back.